Hello. Thank you for joining Nikki's Diary. So, for those of you who are here for the first time, quick summary about Nikki's Diary, which is just where I am talking about my breast cancer journey and all my experiences living with and beyond breast cancer. So, welcome. Let me just start off by saying I hope everybody had a great week, a great day, a great evening, just depending on where you're watching this from, will determine, your time of day. So welcome. Positive vibes out there. Happy vibes. Yes. So I want to start off by talking about chemotherapy medications. Last week we touched on it a little bit, and I mentioned several medications and the side effects of the medications. And guys, please forgive me. So let me just apologize ahead of time or ask for your forgiveness ahead of time. As natural as this conversation is, and all my thoughts and feelings that I'm sharing with you are, I can't remember everything. So I did mention to you all about chemo brain fog, and I told you it is a real thing. So when you hear about it, I heard about it before too, but I didn't experience it. So it's a whole totally different situation once you experience something, So anyway, I have my little cards. So this is because I like to make sure I'm giving out the correct information, and so I don't forget anything. So we had spoke about Red Devil, right? A lot of women who have HER2 negative breast cancer do get Red Devil as one of their treatment drugs. A lot of women with breast cancer in general, it's an aggressive drug. They get the Red Devil. And it, like we said, it's called the Red Devil because of the color. It's clear, it's red. It looks like nasty syrup. I don't know. It is a horrible drug, and it has horrible side effects. One thing I will say, guys, is that Red Devil is also called doxorubicin, I believe is how you pronounce it. And along with that, I had cyclophosphamide. I had paclitaxel, which is also Taxol, is another name for that drug. I had carboplatin. And with all of those drugs, almost all the side effects were the same. They almost all had caused hair loss, discoloration of the nails on your fingers and your feet, causing them to look black, and some had like striation, like stripes of blackness. A lot of the medications caused mouth sores in your mouth, on your tongue, and I mean like look like bruises on your tongue, soreness of the tongue. Those were mouth sores. A lot of the medications we know caused nausea, vomiting. Some of the medications caused fatigue. Trying to think of anything else that I'm not remembering. Neuropathy. That was one of the biggest things. Carboplatin definitely caused me to have neuropathy. I had neuropathy in my fingers. I had neuropathy in my feet. So for those who do not know what neuropathy is, or for maybe some people didn't experience the neuropathy. Neuropathy is when you have that tingling in your fingers. Diabetics get it sometimes. You get it in your feet, and it's a tingling sensation. A lot of people, you get numbness also along with the tingling. And my doctor wind up stopping my treatment at a certain point because he said sometimes that won't reverse. So he wanted to stop the treatment. And he also felt like I had done enough of that particular treatment that I was good. I could stop. And like I said, he was afraid that if I didn't, the neuropathy wouldn't reverse itself. I was miserable with that neuropathy, that I would pick up a brush, and instead of being able to hold a brush, it would fall right out my hand. Like something as light as a brush. I couldn't hold it. I couldn't hold a pen sometimes because my fingers were numb, and you don't realize it, but the tingling, oh, that is so irritating, you know. Yeah, but I experienced all of those side effects: the hair loss, the mouth sores, the fatigue, definitely the nausea and the vomiting, the neuropathy. It was taxing. No, it was horrible, scary, horrible. I also mentioned a drug that the doctors would place, so the nurse would place right here on my stomach, little square device. I don't know, maybe this big, and it, like I said, would shoot the medicine through a catheter, and it would shoot the medication. I couldn't remember the name of the medication at that time, but like I said, cheat cards, because I pulled all of my medical records, and I was so shocked, but not, I just didn't remember because it's been a while since I looked at them, how many records I have, you guys. It was actually overwhelming to pull that and relook at that stuff again, and go through that again, because this started in 2019, and it never goes away, but still it was overwhelming to pull those records and to kind of relive that all over again, because a lot of things I did forget, a lot of things I blocked out, and yeah, those drugs are so hard on the body. That one drug that I couldn't remember, that shot out of that device, is called Neulasta Onpro. And Neulasta Onpro, the point of it is so that it reduced the risk of infection due to the low white blood cell count that you get from chemotherapy treatment. A lot of people who have breast cancer and they get the drug carboplatin as part of their treatment plan, the doctor normally, or not normally, but a lot of times, they would suggest Neulasta Onpro. So I got that every time, and like I said, it does make the bones hurt. And I did have some bone pain. I did have some muscle ache, and it could have came from the Neulasta. Maybe it came from one of the other chemo drugs. I don't know, but I did experience that. But Neulasta Onpro, look that one up if you've never heard of that one before, guys. That was new to me. I never even heard of it. I didn't know that was something that they could do. But after every treatment, I got that placed on my stomach. Okay, so yeah. Come back in my next video, part 2 to this episode. I'm going to talk about some of the different products that were helpful to me because I experienced all of these different side effects from these chemo drugs. So tune in to part 2 to Nikki's Diary. Thank you for joining. Hit the like button, share, and subscribe. And we'll see you next time.